Hello and welcome to the interview here on France24. My guest today is Niranjan Hiranandani, President of the Indian industry body ASSOCHAM and Managing Director of the Hiranandani Group. Thank you very much for joining us here on France24 today. Now, India is in the midst of a lockdown to contain the spread of the coronavirus. How much thought was put into implementing the lockdown when it did go into effect? Because it seems that the government in Delhi was caught off guard when we saw those millions of migrant workers leaving India's cities to make their way back to their villages.
You have to understand that India is a very, very large country. It is almost the size of the whole of Europe. So the situation is that they have not been able to anticipate every aspect of the problem which is taking place. Second, we have a federal constitution, which means the states are separately controlled and managed as compared to the center. So the individual state governments have independent policies which they can actually implement at the local level. Looking at the two, I think some lack of communication in this problem which has taken place, and that's not the only problem. There are several problems in a lockdown situation, and a large number of them are economical rather than medical. So I think the issue of the economical problem, economics being wages, it means employment, it means safety, it means health, it means a lot of things. So economics, not simply in terms of money, but also in terms of the safety and security of the people.
Indeed, economics and food on the table is an important part. We'll get to that later. But I want to talk about the Prime Minister Narendra Modi calling for the lockdown to end in a staggered way. Is it too soon to be thinking about that yet, considering India has not reached its peak?
Again, I repeat that India is a very large country. And there are portions of this country where there is absolutely no COVID-19 case at all, not even in the entire state, like the Northeast and other places. While the concentration is more on those major cities where communication with the external world has been huge. So metro cities like Mumbai, like Delhi, like Calcutta, like Chennai, all are negatively affected. And of course, the continuation of those have been extended to the rest of the country. So when they say lockdown to be phased out, it means that those spots which have no extent whatsoever of coronavirus at all certainly should be brought back. And as I said, there are going to be what they have identified as hotspots, red hotspots, yellow spots, and green areas. So green areas are likely to be opened up. Yellow and red are going to be locked down. But I'm more concerned to see whether the economic situation is also going to be taken care of, because there are lots of issues on the ground about that.
Now, we have seen companies around the world, swing into action with this coronavirus pandemic. Indian companies are no exceptions. We have, some of them producing hand sanitizing gel, masks, ventilators. Are these efforts enough in India, given the state of India's healthcare sector?
No, India has a huge population, as you are aware. And obviously, if this coronavirus goes out of control, obviously, like any other country in the world, obviously we are a poor country compared to the Western world. And the amount of healthcare is not as strong as the rest of the world. That's why we had to bring about a much more intensive lockdown than the Western countries. And you must have seen the net effect of that has been that there have been lower deaths and lower people required to come in the hospitals. So we still have a large number of hospital beds available, a lot of ventilators still available. Of course, one can't say about the future, but as of today, I would say at least the healthcare system has been able to manage those difficult cases which have come about to the hospitals. We are still having empty beds ready for receiving more serious patients into this system, healthcare system. So though the healthcare system could be better and bigger, we are still able to manage the current situation as of today.
Now, you're president of ASOCHAM, and that industry body is calling on the government to spend between $200 to $300 billion to stimulate the Indian economy. Is that enough, given that things were not going well before the pandemic?
I think I don't know whether it's enough or not. Only time can tell. But the point is, we counted it as 10% of GDP, and that was the whole idea. That if 10% of the present GDP values could be considered for the purpose of spending, which comes to close to $300 billion, I thought that would be a kind of a figure which would be reasonable. I think many of the Western countries have also done between 5 and 10% of the GDP of their countries as in terms of what we need to do. So we thought that the Indian economy needed a similar infusion. Only time can tell whether that will be less, more, or too much, or whatsoever. There are two opinions on this matter, and many of my friends have contradicted me that I'm asking for too much, but I agree with you. It may only turn out to be less.
Now, the unemployment rate for the month of March has come in at 23%. That number is actually much worse because it does not take into account, migrant workers who are really the backbone of the Indian economy. They work in construction, they deliver food, they're plumbers, etc. Do you fear that after this lockdown ends, whether in a phased manner or otherwise, luring them back into the cities will be hard?
Well, the answer is yes. But you have to understand that in my whole career of work of 40 years, I've never seen a situation which is like today, which is 23%. But I don't think it is possible to benchmark this correctly, simply because with the lockdown situation, obviously the unemployment is going to be much higher, and we have to see immediately after that. Number two, most of these workers which we are talking are dual working people. They also work on the farms and agriculture sector. So we are going to have the harvest and sowing season coming up in the next 15 to 30 days. So a lot of employment will go into the farming sector, and those people will be busy over there. Yes, the industry and commerce is going to find it difficult to get them back quickly if the lockdown is opened up immediately. We will have some difficulty, but we are hopeful that we'll be able to get these people back in a reasonable period of time.
Will wages need to go up?
Not really. With the economy being soft, I don't think real wages are going to go up at all. In fact, wages may actually come down because of the economic situation and the people not being able to afford it. Wages are not likely to rise in the near future. But over a period of time, yes, as the government is pushing a large number of infrastructure projects, I think that may happen. So you're seeing bullet trains, you're looking at metros. In Mumbai, for instance, we have 300 kilometers of metro being constructed. We have the Cross Harbour Bridge, a new airport, Navi Mumbai Airport. We have connectivity of a coastal road, the Mumbai-Nagpur Expressway. Huge amount of roads, ports, and others are being constructed. So a large number of people and positions in terms of diversion into that sector.
Now, you're managing director of the Hiranandani Group, a real estate conglomerate in India. This coronavirus pandemic has taught us that companies can get their employees to do the work at home. Where do you see the future for the real estate sector in India? Will companies still, spend all that money on fancy real estate when they can get the job done for free, essentially?
We always used to think that about stores and retail stores, but the retail stores also continued. And second, home and shelter is a part of not a house and home as is treated in the Western countries, but it is actually a part of the social security of people in India. So a shelter is considered a very, very big social security for every Indian that exists. And that is why we have a policy program by the Prime Minister of India called Housing for All, and now rental housing for all, which is now a program which is worked out where almost 10 million houses have been constructed in the last 3 to 5 years, a total period of 5 years. We plan to deliver that many houses to the affordable housing segment. So housing is imperative. Demand is going to still be there. And a large number of people in India still are begging for houses.
And very quickly, do you think India's federal structure, really helped in this coronavirus pandemic lockdown to, keep the curve down, essentially, for now?
Yeah, I think it does. There are lots of good examples of various states which have been effectively handling the coronavirus case. Rajasthan in Bhilwara is one such example. And many of the states have been able to effectively control the spread of coronavirus in their states and been able to look up at the local level. It's impossible for a large country like India to have the government in Delhi to look after the entire country and manage the nitty-gritty of people at the grassroots level. The federal structure actually is hugely benefit in a country which is as large as India.
Indeed. Niranjan Hiranandani, we're going to have to leave it there. Thank you very much for joining us on the interview today. And that's where we leave it. Thank you very much for watching.